Hi, I'm Dr. Hart, and I'm going to be treating Lucina for her back pain and her neck pain. So we're going to start by doing a little bit of trigger point release. This is great for treating whiplash. She was in a car accident earlier this year. Too many needles because people freak out, but you know what I mean? If they think it's like 3, they're like, oh, okay. Oh, that's okay. I'm gonna do yours kind of goes into here, right, as well in your scalenes.
I feel like my upper traps have been really bad too because of finals week.
Yeah, I guess actually this one right here got a little bit of action in that one. So I'm releasing the muscle that's pinching the nerve, which oftentimes when people get tingling into their arms, the muscle's really tight. So using this trigger point release, it forces the muscle to release the tension that it's holding, gives enormous amount of relief. How's your kind of mid-back? I didn't really do through here, but...
That's pretty good.
Yeah?
Yeah, no complaints with that.
Okay. So acupuncture increases blood flow to an area that might be injured, and it initiates the body's own healing mechanisms. It also releases what are called enkephalins, your body's natural painkillers, that are anywhere from 6 to 10 times stronger than morphine. I'm going to go see another patient right now, and then when I come back, we can do the cupping. Nothing so exciting as removing the needles. Moving cupping helps to break up muscle tension. It gets in between the muscle, the fascia, and the skin layer, creating space. It also works to flush the lymphatic system for detox. It feels kind of like a massage. So I'm going against the muscle fibers to really help to break up the tension. going to do, I'm going to put them all on one more time. I'll do it really fast and just let them sit. So I think I should be able to get them to stick on your neck today because I have little ones. How's that? What about this one? Yeah? Okay. So this is what we call static cupping, where we just place the cups and let them sit. I like to do a combination of static as well as the dynamic or moving. Moving really helps to break up the muscle tension. As I was moving it earlier, you can really see you can break up the knots, go against the cross fibers of the muscles. And yeah, anyway. A little bit of CBD cream on after like a little bit of massage. So I can do that and then we'll be done. So most people are concerned about getting bruises from cupping. The reason that you would get bruises is if it's in an area of pain or injury. If it's purple, that generally means somewhere where you've had an accident or there's pain. If it's red, it tends to be more inflammation. Actually, the more and more you do cupping, the less bruising there will be, and that's a sign of the muscles and the tissues being healthy and properly oxygenated. How does it feel after that cup was nice in there on your scalenes? Cold, yes, very much. Because here we have the lungs, so it's very good. It helps to bring blood flow to the lungs, can work like an inhaler. She was presenting with frozen shoulder, pain into her arm, and limited mobility. And so we did a combination of distal and local acupuncture with as well as some cupping. And she has improvement from less than 90 degrees to overhead. Okay, so Julietta has bulging discs from C2 to C7 and pretty much has about a frozen shoulder. And before we got started, she could only lift her arm up to about 90 degrees or maybe a little bit less without pain. And so I just did some what we call distal needling technique. So I did some needles in her leg to use a mirror image to unlock her frozen shoulder. So Julietta, do you mind to lift your arm up again just like you did?
Again?
Yes, please.
Yeah.
And now she can get it overhead, where before she was at 90 degrees.
Yeah.
And now feels much lighter and less pain.
No, not pain.
No pain. Wonderful.
Yeah.
Excellent. You can go ahead and relax your arm. I think if we would have got you the before and after, but I'm trying to see, maybe we might. Can you go ahead and lift your arm to the side? If you start maybe next to. Okay. So try to lift like this way. Okay. Yeah. Let's see. Not quite. She can do it to the side. If you can, hold on, this way, and then lift the arm this way. Yeah, okay, this way, towards me, this way. Oh, this one. Any pain?
No, here.
You feel a little bit there. Okay, let's see what we can do for that. You can go ahead and relax. All right, Julieta, let's have you do the exact same thing out to the side. I'm going to see if that is improved at all. You can kind of keep it down. There you go. Excellent. All right, so as I was saying, this is distal needling, and I'm using mirror images of the ankle for her shoulder. And so we have this external malleolus. If you think about this bone is round, it kind of looks like the shoulder bone up here. And so using the different meridians that are related to different muscles, I'm using the mirror image to unlock her frozen shoulder, and she just had so much more mobility and now no pain. So successful treatment. So we're done with the treatment. I'm just going to remove needles. So you have just a little bit of drainage from the edema. It's actually really good to get some of the fluid retention. So even though we were doing the treatment for her frozen shoulder, she has some diabetic neuropathy. So needling directly into the legs is going to help with circulation, get the blood flow moving back towards the heart, help to flush out this. It's actually a bit of a pitting edema. But primarily I was using this as the mirror image for doing frozen shoulder treatment. All right, so let's go put one there, there. Oops. And so numbness into here, right? So let's try one like this. There we go. Okay. So let's see. Try and move this hand. How does it feel? Does it feel any different?
Little, yeah.
A little less pain or a little? Just relax this one.
It's a
little less pain.
Okay.
But the numbness, it's no difference. Like
Okay. So the numbness, that's okay, but the pain is better.
Yeah.
Okay. How much better? Just a little bit? Well, you're not as reactive when I'm touching it. Before she was going like this when I did that. Let's try maybe a couple more needles on this hand and see if we can. Right there. Ooh, sorry about that one. Felt that one. Let's go for one here and there. Okay. All right, so let's try this hand now. How does it feel?
No pain.
No pain. Excellent.
Yeah.
But the numbness still, I bet. Yeah, okay. I think, like I said, we're going to maybe try to open up some of the tight muscles here, get the blood flow, get the nerves a little looser. So let's try, we'll do a little bit of... And I feel like because of this nerve compression that she's getting is probably why you're having a lot of the numbness. So if we can... You can see she's got a little bit of kyphosis. So all through here, she has herniated discs from about C2 to C7. So it's going to be impinging the nerve, and so that's why she has numbness down into her arm and her hand. So placing needles right around the cervical spine can help to absorb the discs, get rid of the inflammation, give better blood flow, circulation to the nerve so that she can get feeling back into her hand. Okay. So this is more what we call the local needling technique, needling in the area of pain or injury. The treatment that we did on her legs and on her opposite hand are more of what we call the distal needling, so not needling into the area of pain. The benefit of distal needling is then you're able to move the arm or the shoulder and actually see the change, increased mobility, less pain, which in this case, both times she had no pain in her shoulder and then in her hand right now with the other treatment. So this might take a little bit to get more of the feeling back, but you're responding really well to the acupuncture so far. So that's very good indication.
There's
no pain, but the fingertips, she says, kind of tingling.
Feel numb, yeah. All right, go and just relax. See, now that the needles are there, you can't move your arms so much. So, and the only downside, sometimes needling into the area of pain, and it actually creates a local inflammation and can make it feel even more sore or tender. And like the next day is when you start to feel better. And so that's the benefit of doing the distal treatment like I did on your legs. Immediately you said, wow, I can lift my arm, no pain. So. I think, you know what, I'm going to also do a couple needles on the side just because she should be compensating. Since she can't use her left arm very much, she's been using her right arm pretty much to do everything, to get dressed, brush her hair. So give a little attention to the shoulder as well. Cup.
In Slovenia, our grandparents like.
Oh, you know this?
Yeah.
Oh.
When you have like fever and cold.
Cold, yes, very much. Because here we have the lungs, so it's very good. It helps to bring blood flow to the lungs. Can work like an inhaler. Good for cough, cold, congestion, asthma. Yeah, of course. I'm gonna put one over here. It's okay. All right.
That's the sound.
Okay, now I'm going to put a little bit of CBD cream on. So we're just going to massage the sun. Does it feel good? Tender?
She feels very, like, it's very enjoyable on this side, she said.
Okay, this one is tense, but this one feels good? Okay, yeah, because the muscle's so tight. This one? Let's see how that one is. Further? Yeah, you couldn't even touch your back the last time. That's more mobility. Good. I think that's a great start for one treatment. Yeah. Yeah, before you were about here.
Yeah.
And so now you're actually able to touch your back, so that's great. How's the tingly feel? About the same?
With the needles on, like when she was complaining, it was a lot. Now it's very less.
Okay, good. Well, yeah, I would continue to use it, in the shower. You do this crawling like that. So the shower, the hot water on your shoulder, so it helps to relax the muscle, increase the blood flow, and then you find the limit.
When she's like waking up and washing face, with hot water, the hot water is very enjoyable.
Yeah. Yeah, the hot water is going to relax the muscles. So you might want to take like a Epsom salt bath. So you get the hot water and then Epsom salt. It's good. It's like magnesium salts. It's good for pain.
What do you do with the salt?
Put it in the bath water.
Oh, like that.
And then she could soak in there.
And
yeah, and then we'll stretch. I'm very pleased with the results. Very good. So she was saying that the tingling is much better now, as we were able to relax the muscles and help the blood flow to her fingertips. And also no pain.
Conclusion?
Well, we had a very successful treatment here with Julieta. She was presenting with a frozen shoulder, pain into her arm, and limited mobility. And so we did a combination of distal and local acupuncture with as well as some cupping. And she has improvement from less than 90 degrees to overhead, and also no pain, as well as to the side and to the back, almost able to reach the bra strap. And also more feeling in her fingertips. She was having a lot of numbness into the fingertips and pain, and that's all much better.
Yeah.
Yes, excellent. Wonderful. I look forward to seeing you next week.
Yeah.
Okay. And how fast I am.
Okay.
Let's see, if I were to go really slow, like put the flame inside and go very slow, I already lost the vacuum.
Gotcha.
But see, I go some
Oh yeah.
attention.
Ooh, that felt good. Where can I put my watches?
And put up here.
Oh, yeah. Okay. So
And I'll get a towel from
focus on my neck. Obviously the traps and stuff.
Okay.
SCMs are tight.
Okay.
Levator and pec minor for sure.
Okay. We'll have you face down, so.
All right. So, you guys ready? I want an extreme. I'm an extreme person. And might as well. I'm not a golfer, not yet, but golf nut. Gotta wear pink on Wednesdays. How do you want me face down?
Face down, yeah.
All right. So,
Ready? Go lift
Dr.
your feet
Hart
up.
is here, so kind enough to stay a little after hours, so I get some much needed therapy as well to make sure I'm able to treat everybody that comes in.
We'll do a little in the low back too.
Sure.
Okay.
Oh, you know what? I was feeling tightness on like the glute piriformis today morning and last night.
So I'm just gonna pull that down a little bit.
I don't want to moon my followers though. That's
You're not. I wouldn't do that. I got you. Do you want to put your arms up? No, on the table. There we go. Is that more comfortable?
Yeah.
Face cradle. You know what? Let's bring
I'm
this
good,
down a little bit so you can get your length in your neck a little bit.
Oh, subox.
So I can get into here better.
That's very good.
Okay. All right. So I'm gonna put a little
Especially
oil.
suboccipitals. When I treat, I like to get a flexion on the patient to just expose that area, like give it a little extra.
Yeah, I'll put some cups right here. There you
All
go.
right.
Get all those scalenes.
Oh yeah.
Okay. All right. Okay.
Extreme, please, doc.
You
Sorry, I was.
a little stronger.
Yes, please. So how can you control that? You leave the fire in that cup a little more?
So how I control the intensity depends on how big the flame is and how fast I am.
Okay.
See, if I were to go really slow, like put the flame inside and go very slow, I already lost the vacuum.
Gotcha.
But see, I go lightning fast.
So what's cool is Dr. Hart, with her license, can do the fire cupping. Us as chiropractors in California, we can only use the suction, the pump action, which me personally, I obviously like the fire more. Plus, it's cool.
All right, so let's go for the scalenes right here, and I can glide it right there. Yeah, those are my favorite. Here we go. Right in there.
Oh, the one on the right.
Is
Oh yeah.
tight. You want this one tighter?
Yes, please.
Okay.
Extreme, please.
Let's see. Is tight now?
It's good.
Okay. So my flame is getting a little smaller, so well, it's still pretty strong.
So, what exactly does the cupping do, especially since you're moving it up and down along the muscle fibers? Does like for me, I always explained it as is just separating the layers of tissue from one another. Is there a better explanation?
No, that's a very good way to describe it. So yeah, I'm creating space in between the skin, the muscles, and the fascia. So it's really the only therapy that I know of that's actually creating space by pulling the skin inside the cup. Whereas massage, gua sha, anything else, foam rolling is putting pressure down. Exactly. Yeah. And so for example, right now I'm going to go against the muscle fibers, and that's going to help to break up all of what people call knots or fascial congestion.
Like a cross friction kind of?
Yeah.
Okay, cool.
And plus it feels good, kind of like a massage.
That's great.
And then it also helps to flush the lymphatic system. These are great detox points right here. We have our lymph nodes right here.
So Dr. Hart, do you have the ability to do acupuncture for a patient, let's say, wanted to come in for a detox?
Absolutely.
Or lymphatic drainage, like you said?
Yeah, absolutely.
What is that lymphatic drainage good for? Like, I've gotten a lymphatic drainage massage. He said it's good for post-surgery, as well as it helps you like just slim down. It just washes out all the inflammation in your body.
Absolutely. So, with the acupuncture, we can support the liver and kidneys, which are going to help with the detox pathways. And then this right here, like I said, it's literally just flushing all the toxins out of the muscles, out of the cells, and specifically here out through the lymph nodes. But if there is any body water retention, that's going to help flush it out as well. And just get the circulation, everything moving, break up scar tissue. And like
lymph nodes, for the best way I explain it, it's like the waste management or the garbage disposal of the body. So people who are recently sick, fighting the cold, those lymph nodes are working overtime to remove any of the crap, let's say, from your body. So people like that will definitely benefit from the lymph drainage treatment.
Absolutely. And if someone, as you talked about, has a cough, cold, congestion, asthma, any upper respiratory conditions, we do cupping here, right above the lungs. So I would move that in here. And exactly, it kind of works as an inhaler, brings blood flow to the lungs, help them to expand, and ultimately just clear up whatever it might be. Like I said, I've seen from one day to the next, a cold just gone. Or congestion or allergies. It's really great to support the lung system.
I know I like to talk and get educated on what's being done. I've noticed it helps me get better results. But for patients who want just to get away at therapy session, there is relaxing music that could be played, and you could request no conversation if that's what you want.
Absolutely, yeah. Some people prefer just the static cups, leave the room, they relax. But I have a lot of patients that are concerned about the marks. So if that were the case, I would just do one cup moving. We got a model shoot or whatever, it's, going on vacation somewhere, no problem. But some people love the marks. They're disappointed if they don't have marks.
Battle scars. I love it.
But actually, the more and more you do cupping, the less that it will bruise. The reason it would bruise, for example, there's a little bit of redness that might indicate a little bit of inflammation there. If you see more purple, that's generally an area of injury or pain. And the more and more we do it, you'll see this improve. And that means that the muscles are properly oxygenated, they're healthy. I like to call these ones the Frankenstein ones.
Oh yeah, that's a good one.
But I don't really see any dark colors there. It can look like a big tree.
Surprisingly though, 'cause it is so tight. Oh, that feels good. Do you do any passive ranges of motion on muscles with cupping at all? Or you could put it on my forearm and you have me open and close my hand or flex and extend?
I do that more with the acupuncture needles.
Okay.
Like I was doing earlier with the distal needling. I put the needles in, had the patient move their arm, improve their mobility. We unlocked a frozen shoulder earlier today.
You know what would be cool for them is the one that you actually have a muscle stimulation.
Oh, the e-stim?
Yeah.
Yeah, I do have the machine today. I finally got it repaired. But
So the stim pads that we use in our clinic, she could actually connect that to the needle. So let's say she acupunctures this, she could attach like a car jumper looking thing, I guess, right? Is that what
yeah,
it's
some
like?
cables.
So it actually stimulates the muscle while the needle is inside you.
And
It's
so that
pretty
will
cool.
penetrate actually deep into
So
the muscle and help
maybe
it to
if it's,
relax.
something quick, you could just show them on me since you have me here.
Do you want me to
Sure.
do that, or do you want me to do more cupping?
Sure, let's do that. Let's show everybody what we offer here, Doc.
More of the
Sure.
e-stim or
Yeah,
cupping?
sure.
Okay.
Show this.
Well, the e-stim is in the car, so what I
Oh,
can
no.
do, it's just in the back, I can grab it. Do you want me to put cups up in the meantime while I go
you
grab
need to
it?
turn over.
Sure.
You
Yeah,
want
because
me
you
to
want to do like that.
Oh yeah.
Well, let's see. That's kind of covering your pecs.
Got somewhere to go. I don't want to ruin my hair.
That better? Because then I can get better into here. Do you want me to do
I know pecs are
Just
always
there?
tight and delts, yeah. Whatever you need, Doc. Forearms actually. Jeez.
I'm
Oh,
not
man.
sure if they're going to stay
Oh,
with
for
the
cupping?
hair.
Just do
I
the
can
pecs.
try. I
Just
can
do the
try.
pecs. But the E-stems, forearms would be cool.
Okay. Okay, so keep your arms down. I'm going to go ahead and put that there. So I cupped myself there.
I could do that. Jeez.
What about here?
All of it, Doc.
Okay. This is I'm going to give you like to call the
We're
necklace.
adjusting and compressing with the cox table. A lot of forward muscles, you know, a lot of it is in the front, so it's overworked.
Yeah. Let's see. You want it intense.
I love it. Yeah. If I'm dedicating time away from patients or family, it's gotta be like intense.
Oh, no, it's not gonna
how
stick.
you doing?
Let's see, I guess I can try here, but I don't think, well,
I'll try not to move.
let's see.
Dude, that feels really good.
Where's my other little one?
Would you do anything here for lymphatic? Or like, can you do something with helping improve digestion?
Yes, sometimes for constipation or stomach pain, I will cup the stomach. There we go. Just had to be a little more persistent. Oh. But that one's still staying. Interesting.
Oh,
Whoop.
don't fall.
All right, let me go get the e-stim and you cook. All right, ready to take now. You got some good color. Look at these. Your pecs definitely needed some
Oh yeah.
attention.
Ooh, that felt good. Nice.
You trying to help me take them off? That's just a little bit from the flame.
It felt really good too.
That was really tight. Okay, let me just wipe off a little bit. So yeah, so if you zoom in, you can see a little bit of the difference. The color is a little bit more purple versus a little red. Like I was talking about, red a little bit more inflammation, purple more maybe pain or injury.
If it wasn't for us wanting to do the stems with the needle, you would have kept it on for longer? Or what?
The cupping?
Yeah.
No, I think at that point, I mean, just a few minutes. Sometimes people leave it 5, 10, 15 minutes, just depends. So where would you like me to do the stem?
Do like the forearms.
The forearms?
Like,
Okay. Okay. And then let's do that one too. Okay, that spot. Maybe here too?
Sure. I know, like just this.
Okay.
So there's no muscles going through the wrist, they're all tendons. So the muscles are pretty much here that move the wrist, all tendons here. So this is where you need to get the muscle work done.
Yeah, pretty much anyone I touch right here on the brachioradialis, they're like, oh, whether it's, you know, on the computer, texting, driving. All right, relax, ready? Okay. So let's see, we can do that spot. I think right here is probably another good spot right there. And that one looks pretty angry too. Okay. Do this side too. There. Okay, so I'm gonna hook up the e-stim machine. This is very similar to a TENS unit. However, it will hook up to the needles and actually send the stimulation into the muscle.
So Dr. Hart, like what type of symptoms or diagnoses, like what type of injuries would benefit with this stem needling? Or what's the correct term for it?
E-stim we call for short, electrical stimulation, and
so like what, frozen shoulder or like any muscle injury,
pretty
sports
much
injury?
any sort of pain. What's different is that it releases a different kind of enkephalin. It's the beta dynorphin. Sometimes if, you know, patients have something they need to do afterwards, I won't do e-stim because it makes you so relaxed. You're just like on another planet. So,
Nice.
so it's best to do it at the end of the day, or if you know, not a busy day afterwards. But it like
is advise end of day if you're going straight home
or just
and
have
don't
some time to
obligation.
relax.
Nice.
Exactly. So whereas, you know, sometimes people come for acupuncture on their lunch break,
I
you know, they
can't
feel
do that,
relaxed. But, all right, so I'm going to go ahead and turn on the stem.
You want to tell them to stop for a few minutes, Billy? Or?
This way.
Okay, so we're going to start with your right arm. And it's going to just feel like a little bit of tapping. Let me know you start to feel the tapping. And yeah, we might actually start to see the needle jump a little bit.
Starting to feel it on my left.
Oh, you know what? You're right. I have this crossed over.
Keep going.
All right, so what we're looking for is the highest level of stimulation that you can comfortably tolerate, because after some time your body will habituate and you won't feel it as much.
Keep going, Doc.
Oh, I can see it moving a little. And so when the muscle's jumping like that, that's what we call that fasciculation, which sometimes when I'm doing the trigger point, so this is kind of doing the work for me. It's that constant stimulation to the needle. And so that overstimulation to a tight muscle forces it to relax.
Nice.
It's like if you've been carrying around a backpack all afternoon, you finally just set it down.
So, in a sense, it's using up all the stored energy or ATP, and it uses it so that way it has no more energy, so it has no choice but to relax, kind of thing.
Yes, it's like a forced relaxation. It kind of resets the muscle. Resets the muscle physiology.
It's a little more intense. I could handle it.
Okay, I'm going on the right side now. Do you start to feel the right side?
Not yet. Don't forget I'm an extremist, so until this hand is like jerking crazy.
Okay.
Keep going. I feel it now though. But
Sometimes it goes from 0 to intense. Starting to move a little.
keep going. Don't worry. Go, go, go.
It's dancing.
Keep going.
Sometimes you even find one side is at a different intensity than the other. So right now I have the right arm much stronger than the left. Almost double as strong. Actually, this is at a 2 and this is at a 4.
Oh, you could go higher.
But this one is, see, already with the 2, it's really going. So, you know, that just depends on people's body.
They
And
said how much I could tolerate comfortably, you know.
so let's crank up your left
The
side.
viewers what they want.
You want me to go the same level on the
Yeah,
left
go
side?
for it.
All
Yeah,
right,
this
here
right
we
side
go.
looks-
Oh. Let's see. Yeah, I can see a lot moving right through there.
It feels really good though.
That's what I was saying. Your body starts, it feels like a tapping, and then eventually you just start to get relaxed. Your body starts to release those endorphins.
Bye.
Bye.
Good night. All right. That's our cue. Doc.
Okay.
So good.
All right.
I love treating. It's like, you know, I like giving presents, not receiving them. I'm the same way. I don't like receiving treatment. I like giving it.
Okay. So let's take this one.
Thank you for that.
You're welcome.
So if I was to come on my lunch break, there's options that patients have where they could be here in and out and make it back to work on time.
Oh, absolutely.
Okay.
Yeah.
And how long does a first visit take?
I'd say the first visit takes about 1 hour, like to get to know what's going on, the nature of the illness or pain or condition. And follow-up's generally a little bit faster. It can be 30, 45 minutes, depends on if we do cupping or cupping and acupuncture. Yeah.
Awesome. Thank you so
You're
much.
welcome.
All right. Any questions, just post them in the comments and we'll get back to you. Thank you.
Thank you.
All right, everybody. Stay adjusted. Or acupuncture.
I think maybe I can get some hot towels from your sister's.
Sure, we could get
Does
one.
she have any?
I have one in the storage actually. If you want one, by all means, let me know.
Okay.
Okay.
Yeah, I think patients might like that. If a little hot
hot
towel
towel.
after to clean off the oil.
Nice.
Yeah.
All right. Thanks, Doc.
You're welcome.
All right.